first of all, congratulations on the Kimball Award. Even I've heard of this award before we got the release today. Reaction, congratulations.
Well, it's it's been a gratifying end of my multiple leadership careers, and I'm honored, and I look forward to joining some of my old colleagues at the American Hospital Association to accept it. I think it's on May 5th. So, and as usual, most of those awards are not just for me. Most of them have to do with how successful Geisinger's been over the last 15 years.
Yeah, elaborate on that. I understand what you're saying. You're the name, okay, and that goes on the award. But this behind-the-scene labyrinth of really excellence in so many ways.
Well, we had a perfect, I think, coming together of lots of good stuff over the last, I'd say, 12 years of the 15. I mean, the first couple of years were pretty tough in recovering from the demerger with Hershey-Penn State. But I think over the last 12 years or so, 12 and a half years, our ability to show what an organization that's structured like Geisinger, serving a population that we serve here, which is older, and has a lot of illness, but is very stable. What you can do with a fundamental re-engineering of how care is given, I think that caught the imagination of the nation, and it came at a time when people were looking for different models of caregiving, as we made a commitment to try to ensure what was before ACA 45 million uninsured Americans, and so I think it's been a great confluence of events. Plus, it's been a great representation of what an organization can do if it really gets committed.
Okay, now I want you to give me an answer that says, that's what we did, and we are superlative, but here's what I did. This is what Dr. Steele did here.
Well, first of all, I saw the vision, and I aspired to something that I think was beyond what most people thought could happen. I remember presenting the aspiration and presenting the vision to the board when I first was interviewed in Philadelphia, and so it was consistent with what I talked about early on during the selection process. I think I was able, after the kind of institutional PTSD of the demerger, I think I was able to create a narrative that was a compelling narrative for a huge number of superb people in central Pennsylvania and the Northeast. And then I think we were very fortunate when our first road test for fundamentally changing how we gave care and then how we paid for care, that so-called proven heart. I think we were incredibly fortunate that got such a tremendous amount of good feedback, and then it became a leveraged set of additional road test successes, and so I think I was the cheerleader. I think I was the visionary. Everybody else did the hard work, and I think that it's paid off.
When you see Geisinger, what do you see? And I come up here for interviews, and I come up here if I have something busted. But
well, I mean, I see Geisinger not just as a leader of Geisinger, but I see Geisinger as a patient as well, and I probably wouldn't be alive without Geisinger. I'm 10 years or 11 years older than my father. I'm on average 15 years older than any other male that has been in our family, and there are specific reasons for that Geisinger is responsible for. I would say right now we're up to 4 organ systems that they've worked with me on, and I look pretty good from the outside, if I don't mind saying so myself. But occasionally, when I'm elsewhere or my family's elsewhere, and they go to places that have great docs and great nurses, we're just stunned at how inefficient the systems are. And inefficient systems can really mitigate the best of the providers, whether they're nurses and docs. And so I'm just constantly amazed at how good the overall system of care is here, and how many people, regardless of whether they're heart surgeons or brain surgeons or people who are working in our engineering facilities, actually know what we stand for, know what our 3 strategic goals are, and are really turned on to deliver those. That's an amazing thing.